Good afternoon. It's 1 p.m. We're going to go ahead and get started with the Calhoun County Joint Information Center briefing. This is for Wednesday, November 25th, 2020. Next slide, please. Administrative notes. Please remember to mute your phones. Next slide, please. Our Unified Command Team, Kelly Scott, Ted During filling in for Rebecca Fleury today, and Eric Pessel. Next slide. And next slide, please. And next slide. Here's our agenda. And we will start off today with the current situation report from the Health Department and Eric Pessel. Eric?
Thank you, Dirk. Good afternoon, everybody. Currently, as you can see in our slide, we are approaching 5,000 cases for Calhoun County. We're at 4,918. That was as of 2 p.m. yesterday. Our total hospitalizations are at 269, and we are at 107 deaths. I would just note, you can see the pretty extreme curve on the right side of the slide, and that's obviously the recent surge and increase in cases that we've been talking about. And that is what we want to see start to considerably go down. Next slide. We're going to talk about a little bit about what our current situation looks like. We've had questions in the past of, what's the makeup of the folks from Calhoun County that are being hospitalized with COVID? And this is a pretty good graph to show that. As you would expect, the older generation is having to seek medical treatment in a hospital more than the younger. But I would note that certainly the 50 to 59 has been one that has also been on the increase in our number of cases recently. So pretty concerning to look at that number, as well as what we would expect as the ages go up. We also have on the right side of that slide, we have it broken down our hospitalizations by race, and it's really kind of mimics a little bit of what our breakdown is. Possibly a little bit, well, actually our African American community is a little higher than what our breakdown is in our community. Next slide. A lot of times we brought this up a while back and we thought we would revisit this slide. This is cases that have been referred in the last 14 days. And what is the predominant symptoms that people are presenting with as they have COVID? And really that fatigue, lethargy, or weakness, that still is up near the top. As you can see, almost 80%. Headache and cough, muscle ache, congestion, and then loss of smell and taste is really gone up from earlier. When we first looked at this, I would say 6 weeks ago, loss of smell and taste was down around 25-30%. That's made a significant increase in our cases over the last 14 days. And fever is still about 62.5% of the cases had a fever. That's a fever above 100.4 degrees. But I do want to point out the loss of smell and taste. That's a significant increase. And this is about, I believe, 1,278 cases. So it's a pretty large number of cases. Next slide. Again, a little bit more of our epi info and our trends. We are keeping an eye on our 14-day curve and our percent positivity. As we monitor that, it does help us in decision making. It helps in our communications that we have with you all and with other groups. And obviously it's something that we want to see start to go down and flatten out. Also, this is showing us that we are continuing to see outbreaks in our congregate care settings. Those could be adult foster care, skilled nursing, long-term care, those type of facilities we are still seeing outbreaks in. And we're seeing more workplace outbreaks. And, you know, a couple situations recently that I'm familiar with where, you know, when we talk to the HR, the management of the workplace, it's almost like people are just getting tired of following all the protocols, and the workplaces are trying to do their best. But, you know, as what we're seeing elsewhere, people are just getting tired of following it. And so we're starting to see more outbreaks within various workplaces around the county. Next slide. So to kind of wrap this all up and talking about what's our important takeaway right now, obviously we need to take action now. We didn't talk as much about hospitalization today. I can tell you currently we have 46 patients in a hospital in Calhoun County between Oak Lawn and Bronson Battle Creek. Our hospitals are full and are doing their best to maintain all of their treatment options, and they are still able to do that. But they do, you know, we cannot continue on this trend of an increase in cases or even a high number of cases. So we need to act now. We need to bend that curve both here locally in Calhoun and statewide. We need to continue to really heed the call to protect yourself and your family by following just those simple protocols. And we know if we wash our hands, wear a mask, and social distance, we're gonna do a pretty good job. And obviously, it goes without saying that we want everybody to have a happy and safe and conscientious Thanksgiving and holiday weekend. But we want to do that in a way that we can see those same family and friends next Thanksgiving. So that's my call of action to everybody is be safe and have a happy Thanksgiving. Thank you, Dirk.
Okay, Eric, thank you very much for that message. And up next, go to holiday guidance. And this is Battle Creek Assistant City Manager, Ted Deering. Ted?
Hey, thank you, Dirk. Appreciate it. You know, I think piggybacking on Eric's theme, tomorrow is Thanksgiving. It is a day that we tend to think of as the launch to the traditional holiday season. And we all know how desperate people are to get together with family and friends to celebrate the holiday. And I know that it's particularly tempting this year, given that the restrictions have been in place because of COVID now for months. However, again, as Eric indicated, the numbers are spiking, and it's critically important that we celebrate in a way that keeps people safe this year. So we don't want to lose our loved ones to COVID-19 this holiday season. So we're urging everyone to follow the state and federal guidelines that are out there that are emphasizing the safest way to celebrate this year. And to do that, you need to do it, if you can, with your immediate household. And we do understand that some will celebrate with others if you do that. And again, I believe the limitation right now under HHS is 2 households. Follow the safety guidelines, wear your mask, social distance, and bring your own meal items if you can. It could be the difference between, as Eric indicated, a happy and perhaps a tragic new year. As evidenced by the meetings that we're having like these, you can actually have some fun on Zoom. So consider celebrating virtually. You know, it's a great way to connect with family and friends, and it's also a great way to stay safe. And as usual, the PIOs have provided great resources to help us stay safe. Be sure and check out the guidance video that's on the city's YouTube channel. The link is here on the slide. So have a great Thanksgiving, and let's make sure that our numbers don't spike again because we've all taken the proper precautions. Thank you, Dirk.
Thank you, Ted, very much for your report. We are going to move on to Calhoun County Administrator Kelly Scott. Kelly, go ahead.
Thank you, Dirk. I want to know what Ted Deering is doing on Zoom that is so fun, because I'm not having as much fun as you are, apparently. So if you've been following our lines of effort slide at the beginning of every one of these presentations, we talk about mitigating suffering, saving lives, and protecting the vulnerable. So along those lines, I do think that we should all be thankful that there are efforts in our community to help toward those efforts. So a couple of them that are focused on providing food to those that need a Thanksgiving dinner. The Battle Creek YMCA and the Fire Hub are both offering to everyone and anyone serving size meals to go. in Battle Creek tomorrow, starting at 10 a.m. and 11 a.m. at the Fire Hub. I have to always talk about physical exercise, which is one of the ways that I mitigate my own suffering. And that is, I've done a handful of virtual running races this year. What is a virtual race? This is the first year I've ever heard of such a thing, but basically you sign up and you pay toward whatever charity is sponsoring the race. And then you run or walk wherever you want to at your own pace. And then you post the results on the website. Some of them provide t-shirts, etc., medals for finishing. But I encourage everyone, I think it's still not too late if you register today through the Battle Creek YMCA. I know they have it on Facebook. They're doing a virtual turkey trot 5K. It's a run or a walk, and you have all the way through December 3rd in case the weather's bad tomorrow to get that done. Also, finally, in Marshall, instead of having their normal Christmas parade, they've opted to do the Merry Mile drive-through lights. So kind of like a reverse parade at the Calhoun County Fairgrounds. The floats and the events will be stationary, and you pay $10 per car to drive through, and that starts on this Friday. So we'll move to the next slide. Actually, I forgot to mention another thing. I just saw on WBCK today announced a couple of other things related to community events for older adults living in senior group facilities. MDHHS has scheduled some virtual social hours designed to connect older adults with each other and their families. And some of the events include some fun things like recipe swaps and some basic technology skills. So, and then WBCK also published a list of 25 best Thanksgiving movies that we may all need to watch. And then, okay, so now we're on to the next slide. And I want to talk about your Calhoun County local government operations. So in March, our local governments were required by state orders to limit our operations to essential services, with only our essential workers reporting in person. And of course, our residents were required to stay home, except for getting out to access those limited essential services. So I'm very grateful over the past 8 months for how well our local government leaders and our employees adapted to this shocking amount of change. And because so many of our services are deemed essential, we've never really shut down. But what was different in the spring was that we didn't have the safety protocols, we didn't have the guidance in place to mitigate the spread of COVID-19. We didn't have masks, we didn't have ways to limit the occupancy in our buildings and ensure social distancing. And we didn't have many of the ways that we do now for the public to get services from us and participate with our government operations virtually. So now we all have our preparedness and response plans in place. We have ways to screen the public and our employees and exclude those with symptoms from being in our facilities. And we have so many more efficient options in place than what used to be your only option was to wait in line or sit in crowds to pay taxes or attend public hearings. So right now we are complying with the MDHHS gatherings and face masks order that was issued November 15. And we're complying with MIOSHA emergency rules and their new emphasis on workplace safety, following what Eric reported about outbreaks within the workplaces. And that was effective October 14 and extends for 6 months all the way through middle of April. So through local governments throughout Calhoun County, many buildings are closed to in-person service right now to help prevent community spread among the recent surge of cases. So the city of Albion, the city of Battle Creek, the city of Marshall, and the city of Springfield are all closed to in-person public service. The county has chosen to keep all of our buildings open except for our Justice Center, mainly just due to the restrictions that our courts have on limiting operations, which I'll talk about next. Many individual offices within county government still require appointments, which has really worked well for our staff as well as our residents. In October, our Board of Commissioners declared a continuation of our local health emergency like we had back in March. And that is in place indefinitely to allow all local governments throughout Calhoun County to continue with remote public meetings into 2021 as needed. And especially it will be if indoor gatherings continue to be restricted. So please check our municipal websites, our social media for updates, because many of our local governments have had the occasion to need to close certain offices or certain buildings due to COVID-related limitations in staffing. And the county has been included. This pandemic really has affected all of us at varying levels of disruption for our operations. And then also, please continue to receive the services that you need from our local governments by phone, email, online, make payments at our drop boxes. Our staff are still working and we are here to serve you. Please be patient and keep in mind that remote work is not any longer what it used to be, which was thought of as a free day off. Many of our employees are still providing frontline customer service using their computers and phones all day long from home environments that sometimes include their spouse and one or more children also home being schooled virtually. It's very difficult in some cases for us to balance the home work environment, particularly with working remotely. I want you to also know we have measures in place to ensure accountability. We can measure job performance, and we are now talking about how to take these best lessons learned over the past 8 months during the COVID pandemic and incorporate them into our long-term operational plans so that we can continue to build a better community through responsive leadership. I also just want to mention before I move on to the next slide that amidst all of this change, one thing that hasn't changed is my appreciation for our local, our state and federal elected officials in providing federal and state grant stimulus funding to help with our COVID response. Calhoun County government alone has recorded over $1 million in COVID-related response costs throughout this past year. And more importantly, because of reduced revenues, we would have had an approximate $3 million budget deficit this calendar year without the federal stimulus funds and state grants. We have been able to provide hazard pay to our public safety personnel, and we will be providing yet this year to our public health personnel a similar public health response incentive pay. And we will be able to end this fiscal year with a balanced budget. A couple of other items I've been seeing related to employee policies on the listservs for our local government officials, that right now the Expanded Family Medical Leave Act at the federal level is set to expire at the end of December. So for the county, what that means is while our employees that still have COVID exposures will still be able to get up to 80 hours of leave time without using their paid time off. The one that does expire is the 12-week childcare needs provision. If that's not renewed, then going into next year, if we're still having employees that need to stay home to take care of their children, that option is no longer there. So we do urge our legislators to help with, even if there is not additional funding for local governments, we could use some flexibility. We could use an extension of time into 2021 to use our stimulus funding, and also the flexibility to allow us to replace lost revenues. So with that, I'm ready to move to the next slide on courts. So due to the high positivity COVID rate in Calhoun County, our courts have returned to phase 1 of the Supreme Court Administrative Office reopening plan. And as we've been explaining, local governments have been basically following the reopening plan set forth by the state and the state's administrative offices, such as MDHHS and MIOSHA. The courts are under a different jurisdiction, that of the Michigan Supreme Court. So the State Court Administrative Office issued a new administrative order, number 2020-14, within the past week or so. And then they also updated their return to full capacity guide. That guidebook outlines 4 phases to create a consistent approach across Michigan for our judicial branch of government to get back to full speed while protecting public health. And they're doing that in a way that also accounts for differences from community to community. So this updated plan and administrative order, in addition to establishing sufficient downward trajectories for COVID cases and percent positives, they have applied some very specific criteria, which led to our courts and many others basically going back to phase one. And so we've been looking at the spike in cases that happened in the middle of November that led to a percent positivity rate of over 15%. That is now set forth by the state's judicial branch as a requirement to be below 15% to move to phase two. So because our local rate was above 15, we went back to phase one. In order to move to the next phase, it would have to be below 5% to get to phase two and then phase three. Fortunately, with the way that our courts have been operating with all the protocols we've had in place, phase one, phase two, and even phase three are not that different. And I'll talk a little bit more about that. Also, our courts are considering the health system capacity, and that's why our local hospitals and their involvement in communication with us is so very important. I just want to read an excerpt from their updated reopening guide from the Supreme Court Administrative Office, or SCAO. Michigan has never faced a challenge like COVID-19. The pandemic is not only taking lives and battering our economy, but also challenging the strength of our institutions. From day one, our judiciary has met this challenge with unmatched dedication to public service and an unwavering commitment to innovation in keeping courts operating and accessible to the public. So Calhoun County's courts, with leadership of our Chief Judge Mike Jacquinette, our court administrators, Chris Getting for circuit and probate, Kate Ambrose for district, have worked very closely with county administration to ensure justice can continue to be served in the safest way for our employees and the public. They've created an electronic case filing system instead of continuing to wait for the state to create one. They've allowed for in-person services by appointment when necessary. And actually the new return to full capacity guide from SCAO talks about encouraging a culture shift in the judiciary based on these advancements in court technology and remote work capacity that have been achieved over the past 8 months. So this will allow the courts to continue to mitigate exposure risks while increasing the court access to attorneys, the parties, and the public. We've heard from our attorneys who say they're able to handle a larger caseload, save money on travel, and then with the virtual access, you know, the public can participate in ways where they may have had barriers when the only option was in person. Our court employees are working from home to the extent that they can. Our courts have supported remote work options similar to what the county is providing, including the ability to answer their office phones on their laptops from home. Some of these employees have never worked from home before, didn't have the technology or the clearance from the state. And the courts have adopted the same policies that the county has in place for ensuring any of their employees with COVID-19 exposure can be off work without being harmed by having to use their vacation time. So please check the court website. It is up to date and will remain the main source of information for jurors. And as we've previously reported, jury trials are now on pause and have been canceled through January 15. So just an emphasis that every local chief judge is still going to rely on our public health information. They're going to consult with Eric Pessel to inform decisions on the operational status of their own courts. So I am just very appreciative for our countywide local government leadership, for our elected officials. I welcome our new elected officials from the city of Battle Creek and others. Hopefully we can continue to work together, take the lessons learned and move into a new way of doing things in 2021.
Okay. Thank you very much, Kelly Scott, Calhoun County Administrator. Appreciate that. Next slide, please. Okay. Comments from elected officials, and we'll go one by one here. Senator Bison, are you with us today?
I am. Thank you so much for the opportunity to come and join you. It's been exciting being here. We've already been having caucuses where we are trying to decide what we're going to be doing with the remaining time in lame duck. I think that as our administrator had pointed out, there's still a lot of things that need to be done. And we'll be looking forward to communicating with the governor on COVID response. And we anticipate passing a number of bills that ought to help with the COVID problem. I am being told that the state of Michigan may be getting a couple of 100,000 vaccine doses to start with. And so we'll be looking forward to how that gets out to the public as well. There are a number of legislative things that we are going to be looking at to include healthcare community immunity. Apparently the pharmacists are having problems with patients coming back, not having the refills, can't get into their doctors. And we may be looking at something along those lines as well. Apparently we're charging 18% interest rates on property taxes when they aren't paid on time. And given the circumstances that we're in, we're going to have to look and see whether or not that's excessive at this point. We've had a lot of people who are getting relief. We have a lot of people who are trying to pay property taxes with rental property that they aren't paying any payments on. And because of that, there becomes a question as to whether or not that holding them to that 18% interest rate is appropriate or not. We have a number of things on deck for this lame duck session that's coming up. I'm trying to think of what else is significant coming forward. Karen is with me, and Karen does most of the UIA for the office, and she has an update as well. If I could introduce her, please.
Hi, everyone. Just quickly, I'm sure, as you know, the UIA will be closed on Thursday and Friday, but some of the UIA staff are working voluntary overtime hours, and they will be making outbound phone calls on Friday only. So there is a possibility that claimants could receive a return phone call on Friday. So just wanted to make you aware of that. They asked us to pass that along. And also for those who recently have been laid off, the UIA is asking if you previously had a claim during COVID, not to file a new claim, but to reopen your old claim, reopen the claim that you did have if you were previously unemployed. They're asking you to do that within the first week of your unemployment. So that's the UIA update. And then just one other thing with Secretary of State, anyone who was assessed a late fee during the month of October, a late fee because you couldn't get into UIA, and you couldn't get an appointment with them. Secretary of State's office assessed those late fees because of a statute, but the legislature passed a set of bills, as we know, to correct that. And so the Secretary of State has put out a form that people can fill out to be reimbursed, to get a refund for those late fees. And so we do have that form. You can find it on the state of Michigan's website on the forms page, but we have that form as well. So if you want to contact Senator Bison's office, we can personally get that for you. That's all I have, Senator.
Thank you. Are there any questions for me? Can I take any questions? And if not, that's perfectly good too. Thank you.
Okay, great. Karen, thank you. Senator Bison, thank you very much for the report. We'll move on to Representative Hadsma. Jim?
Thank you. I think Senator Dr. Bison and Karen Todd have addressed many of the issues. I will tell you that we're returning to session on Tuesday. The House hasn't been able to have session on several occasions this autumn because one member or another continues to test positive for COVID-19. So given some of the issues that Dr. Bison has indicated, budget issues as well as issues to ensure that we continue to have a response to COVID in context of some of our responses legislatively, sunsetting on December 31. I'm confident in December we'll be acting on those issues, notwithstanding some challenges in terms of positivity of some of our House members this autumn. Thanks. Have a happy Thanksgiving all.
Okay, thank you very much, Representative Hadsma. We'll move on to Representative Hall. One more check on Representative Hall or an associate. Okay, hearing none, we'll move on to county elected officials. Any county elected officials that would like to speak? Hearing none, we'll move on to tribal elected officials. Any tribal elected officials? Hearing none, we will move on to city elected officials. Any city elected officials? Okay, moving on, township elected officials. Township elected officials. And finally, village elected officials that would like to speak today. Okay, we will move on to the next slide, please. Here's a list of best information sources. If you'd like to drill down some of the information you've heard today or look for new information. Also, I'd like to mention the chat area and a big thank you to Carla Fales for providing some links and information to all of us. Thank you, Carla. Next slide, please. Incredible work goes into this from these two people, Lucy Blair, Communications Manager, Calhoun County, and Jessica Vanderkolk, Communications Manager for the City of Battle Creek. They put this together, an amazing job, a lot of work. Also a special thank you to Sarah and Cindy behind the scenes, City of Battle Creek, that actually do the production of this. If you need to contact any one of these people, you certainly can. And that ends our briefing for today. And I would like to wish everyone a happy, healthy, and safe Thanksgiving. Take care. Thank you.